So we're going to talk mostly about today is kind of preparation for the exam. If you guys have questions about like how to sign up or how to get, come talk to Susan or I, we can help you with that. I'll mention it today, but that's just not the focus of this presentation. I'm going to talk a little bit more about test prep. Okay. So, certifying exams. I'm going to talk a little bit about the exam results that we have. So we do track exam results so that we can understand how our students are performing. We utilize that as what we call a measure of institutional effectiveness, to kind of see how successfully that our program is preparing people for those exams and how well the students are performing. We also track that because it's one of the measures of institutional effectiveness that the accreditors require to be able to track and demonstrate like 80% or better pass rates for NCCAOM as an accreditation requirement from ACOM as well. So we have the 80% requirement that we use for ACOM, and then we also have our own internal benchmarks that we set both for state rates of pass rate in the exams, and then we also try and set benchmarks for like the scores people are making on exams. When you guys take the exams, they'll tell you pass, fail, but they won't always tell you what the score is that you're getting. The only time they'll release your score is like if you fail the exam, then they'll let you know what your score is, but they don't always necessarily tell you what your score is if you pass the exam. And so what I've found is that often students will pass the exam but they don't realize what their actual scores were. So it's like, did you pass with 70%? Did you pass with a 75? Did you pass with 9%? So like you don't necessarily know how well you performed, you just know that you passed. And so we found it's a little bit, it's helpful. And so we want to make sure that people know, what the, kind of get a sense for how well people are passing it and the kinds of scores people are seeing. So they break them up into the foundations. This is the data we've got all the way back until 2008. We don't have 2020 yet because of all the bizarre stuff that's going on with COVID. They haven't released data about that yet because it was hard for them to gather. Typically they release data about twice a year, first half and second half of the year, which will usually kind of come out about 6 months after the exam's taken. So the second half of the year, they give me the first half of the year's exam results. In the beginning of the next half of the year, they give me the second half of the previous year's exam results. We actually pay additional fees so that they'll release things like actual scores people have achieved on the exams and things like that. And so these are, so the numbers that you can see are the percentage of this document, or the percentage of pass rate for students coming out. The red line represents the national average of pass rates for this NCCAOM. Foundations have been traditionally a little strong. We've had some dips at odd campuses over the years that we've been trying to address for the last couple of years, but typically foundations has been a pretty strong result. Okay, just looking at Santa Fe students in 2019, first-time test takers, most of them passed kind of middle of the road, right, 75, 79. It's the majority of pass rates for first-time test takers. Second attempt, what I find when I look across all of the data, people that are on their second attempts, third attempts taking the exams often are not performing very well, which seems weird, right? You've seen the exam already, right? Why would you be doing poorly? What it seems to be is that typically those are students that have been out of school longer, right? That's why they're on their second, third round of taking exams. And I think often they're people that had other issues either in their life or were struggling in school initially and are struggling to complete the exams a little bit. So a lot of times actually the second and third time test takers will have seen lower scores, okay? Or at least not as good scores as first time. Acupuncture exam. This one has traditionally been a pretty challenging exam for a lot of people, although over the last couple of years we've seen a pretty steady increase in pass rates and scores coming out of that. Kind of a middle of the road score again, so a lot of people passing but not high passing, like 75s plus. Again, you can see those like second attempt exams, not strong compared to some of these first time exam takers. Okay. So again, what our data tells us is when you're finished with school, you need to take these exams as soon as you can when you're completing school. The longer you take after completing school to take the exams, typically the poorer the performance is that we see. Okay? Biomedicine has traditionally been kind of a struggling exam. You can see both our scores and national averages have kind of gone up and down over the years. That exam is the newest module for the NCCAOM, which didn't actually exist until like the early 2000s. I was one of the first rounds of people to take the biomed exams. It was about a 60-question exam. It's now been it's been extended to 100 questions. Okay, so it's a little bit more significant exam than it used to be. I think the thing that seems to be the most challenging for people about the biomed exams is that the subject matter is so large, right? Biomedicine, right? It's like, geez, what does that encompass? Like pretty much all of the things that are in our Western curriculum in school, all of it's fair game for biomed exam, okay? The other thing we like to ask you about biomed exams, ethics questions, questions about Hipaa compliance, all of that stuff gets rolled into the biomed exam, okay? And so I think that makes it sort of one of those exams that it's harder to kind of anticipate what to focus on. They do provide you with content outlines for that, and I'll talk about that in a minute. Santa Fe biomedicine scores, again, we had struggled with it traditionally. We actually did a lot of work in our curriculum to try and identify where we thought there might be deficits for people in the curriculum. Over the last few years, we've seen steadier increase in biomed scores. And again, most people passing, but not necessarily high passings. We like to see, again, I talked about, for the NCCAOM, they set that 80% benchmark for pass rates, and then for us, we try and set an internal benchmark of liking to see students passing with 80% or better scores, or 85% or better scores on some exams, and sometimes as high as 90, like for foundations exams and stuff, we like to see students pass with 98%. And off and on, honestly, to see we only have a few students often that have been meeting some of our own internal benchmarks over the last few years. Why that is, I'm not sure. We've done a lot of investigating into curriculum. We've done a lot of investigating into exam taking and performance in school, and correlating with previous degree and all kinds of things. The best that I can identify heuristically there is that there seemed to have been a culture of rigorous preparation for the exams that sort of declined over the last few years, okay? When I used to teach about, say 10 years ago, most of my cohorts, every single conversation I had with those cohorts after class was, hey, where are you going? Are you going to the Cowgirl to study for study group this week? Oh, no, I don't know, I'm going to be there. Well, you better come. And that was really consistent. Consistent study groups, consistent preparation is really important to NCCAOM, okay? And for whatever reason, over the last few years, I've seen a little bit of a decline in that culture. Biomed scores kind of all over the place, but we've seen an increase in those. And again, passing rates kind of on the lower end for some. Chinese herbology has been historically relatively strong for us. National average, we've seen sort of a decline in scores on the Chinese herbology exam and pass rates. Ours have stayed relatively strong, although we did have a dip in 2019 specifically. Like the year before this was a much stronger year for herbology and Santa Fe. Scores. What I found with the herbology exam is there's not much middle ground. Like either people pass it and they pass it with a high score, or they don't pass. So what that indicates on, I guess, preparation again maybe, and then focus on herbs maybe is another one. Really like setting that exam aside to study for separately than some of the other exams. And again, people taking more time to get out after they get out of school typically have a harder time. That's one of the challenges I see with people coming back from out of state too. Like they practice in college in states where they don't require herbology to practice, and then they come back to New Mexico, and all of a sudden the board's like, nope, you have to have the herbology module in order to get a license. And then all of a sudden they're struggling, trying to retake that exam. So again, as soon as you get out of school, as quickly as you can, try and complete all your national exams. You're in the mode of being in school right now. You're in the mode of taking exams right now. The longer you wait after you get out of school, the harder it is typically to pass exams. Okay? That's just what our data indicates. Especially something like herbology, right? A lot of people aren't practicing herbs as much when they get out in some of those other states. And so, they just aren't as familiar. And then when they're required to take it, they have a hard time. So if you can get that diploma and then just maintain it, right? You're not going to have a problem if you end up having to move to some other state, leave at New Mexico and come back, you'll have it for yourself, okay? So again, typically, Santa Fe pass rates in particular tend to, pretty strongly, consistently go above national average. Okay, so when you want to sign up or you get information about the exams, just go to the NCCAOM website, which is nccaom.org. This is basically the front page. If you want to learn about preparation for the exam, go to the applicants, click on the applicant resources, and then it'll take you to the applicant toolbox. Okay, and then on there you want to click on what they call the exam preparation center. Okay, and that's going to have information about the exams and the information that's on the guidelines about what's on the exam. So in the Exam Preparation Center, there's actually 2 places you can go for this information. You can either go to the Preparation Handbook, which will give you information about all kinds of stuff. It'll give you both the exam expanded content, and it'll give you information about how to sign up for the exams and frequently asked questions and all the resources that you'll need to go through the process. Okay, and so this is the Exam Preparation Handbook. So make sure and really, if you're not familiar with NCCAOM at all, if you haven't looked at it yet, read through the whole handbook. Okay, you want to read through, make sure you understand all of that information clearly, just so that you understand how you're signing up, what the deadlines are, and how the process works. Okay, so the other place you can go is just the exam content outlines, which takes you just to where the exam information content outlines are. Again, these are contained within those larger exam preparation handbooks too.
Hey, Paul.
Yes?
I was only able to find 2020 ones. Or is that the most recent?
That's the most recent. So you want to get the one for 2020, nothing earlier than that though, because they changed the exam in 2020, right? So you want to make sure that you get the most recent. Okay? I think they've actually pulled down the 2020, anything less than 2021. So when you pull up these exam content outlines, what they're going to give you is they're going to give you, foundations. They're going to read by module, and really what they do is they give you an exam content outline for Diplomate of Oriental Medicine. So that'll include acupuncture, foundations, biomedicine, and Chinese herbology in that one exam content outline thing. Okay, because that's all the modules you need for that diplomate, right? When you get diplomate in acupuncture, they might say, oh, okay, well here's the exam content outlines for biomed acupuncture foundations. Okay. And so within each of those exam content outlines, they'll give you foundations of Oriental medicine, for example. Then they'll divide each of the subjects that you need to know into domains of knowledge, right? So domain 1, clinical examination method. And then they'll tell you how much of the exam, of the foundations exam, is on clinical examination methods. 38.5% exam in clinical exam methods. Then within each domain, they break it down. What are the specific topics they need you to know within the domain of knowledge? So for physical exam, examination methods, you need to know your 4 examinations, right? Looking, and then within, looking, palpating, listening and smelling, interrogating, right? And then under each section, for looking, you need to do inspection of the spirit, inspection of the eyes and nose, inspection of the tongue, and then within the tongue. So understand the coat, quality, moisture of the tongue, right? So they break each domain into those subdomains of knowledge to know. And that they're telling you precisely the kinds of things they're going to ask about examination. Yes?
What resources is the NCCAOM basing their questions off of? Is it Machiosha? Is it CAM? Is it Shanghai?
All of them.
All.
Okay. So they give you a disclaimer, essentially, at the end of these where they say there's no single source that provides all of the information for NCCAOM. Okay? But we check our resources and our information through the following bibliography. Okay? So they do provide a bibliography for each one, but keep in mind, no single book is the source, quote unquote, for NCCAOM exam content. Okay? Which is a frustrating thing for them to say, right? But that's it's not any one book, but here's a bunch of books, maybe go look. Right? But that's how they're operating. Okay? So that means you got to compare sources, right? So about the exams, they are an adaptive exam. So what happens is when you answer a question correctly, you actually get a harder question the next time around. Or if you answer a question and you get it incorrect, then you might get an easier question the next time. Okay? So the program, if you fail to answer an easy question, the program might ask you a more difficult question based on the same topic. So after asking you all these questions, it creates a collated score based on all of these adaptive questions. Okay? And so, consequently, your experience of a student is you don't know, right? It's this felt easy, and now it's feeling harder, and now it's more, it's you're not really sure how you perform necessarily, but they will tell you your outcome at the end of the exam. They'll give you what do they call it, a preliminary outcome at the end of the exam, so they'll tell you have passed this exam at the end. And then you'll get more information. Yes, ma'am.
Are the questions weighted?
Or
are they all worth the same?
I'm not sure. I think that they are weighted a little bit. It has to do with how the adaptive software grade scores the exam.
Right.
So you have the same number of questions, but no two of you might get exactly the same set of questions. Does that make sense?
Yeah.
Like they all come from a big pool, but no two students will get the same question. So studying. When you're preparing for the exam, you need at least 3 to 6 months for each pair of exams. So if you would have 4 exams you got to complete, my recommendation would be to take about 2 exams at a time. Don't sign up for all 4. It's probably not the best way unless you think you're a super student. Okay? But I would tend to recommend breaking it up into sets. Like, sign up for 2, get those completed, then sign up for the next 2 and get those completed. Okay? Because keeping in mind for each 2 exams, so for example, foundations in acupuncture, you're probably going to need at least 3 to 6 months to prepare. Okay? And you need about the same amount of time for bioscience and herbs. Okay? Which order that you do them in, it's sort of up to you. I knew a lot of students that tended to take the herbology exams first, just because if you're on like a 4-year program, or even a 3-year program to some extent, like that last year or so of school is pretty heavily weighted in herbs, right? Like a lot of your courses are on herbal medicine, a lot of your courses on formulas, you may have done herb review recently, and so that's kind of like the freshest in your mind, okay? So I've often seen students break up their exams that way. It's up to you what you feel the most comfortable for. I will warn you that acupuncture has kind of historically been a challenging exam for people, which seems weird, right? Because it seems like, oh, that's the thing I should be most familiar with, right? But think about it. When was it, those of you guys that are getting into your 3rd and 4th year, when was the last time you did a point location class, right? And like if you're in clinic, you probably feel really confident, right? But how many points are you really using in clinic every day? Right, maybe 60? You've seen all the antique points, right? Fingers to elbows, all of them. So, maybe 6 points, right? Maybe depending on how you count some of them, right? So maybe those are what you're using every day. But remember, there's 365 plus extra points. And you've got to know exactly the location, be able to recognize the described location or the visual image of all of them are potentially on the exam, right? So if it's been a while, it may be harder for that information to come up for you. Right, so that's why I think sometimes we saw a bunch of people assumed they knew it really well. Right? Hey, I did point location already. I've been really great in clinic the last year or so. But they don't know all of the depth, like the detail, right? Because you haven't had to. Right? So you got to really conscientiously review that kind of stuff. And so that's why I've sometimes seen people break up the exam. They're like, oh yeah, I just finished herbs, so I'm in the groove of studying for herbs, right? But you got to make sure you get into the groove of studying for everything, right? And you'll figure it out. So part of the way you study is you got to create a comprehensive list of the domains and subject matter. Nicely, they give you that already, right? That's what your exam content outlines are. They give you the domains of knowledge. They give you the subjects within each domain that you need to be familiar with, okay? So then what you got to do is take all of that information, and when it says, observation of tongue, coat quality, moisture, and color, then you need to be able to go, okay, now I got to go look up all my tongue coats and qualities, make sure I've got all that information, all the, the appearance of the body, colors, moisture, all that, so that I know the indications of all that stuff. But you got to fill in all of that information from your notes and the sources, okay? So you got to prepare all of that stuff, okay? And then you want to split it out into sections. So you want to split your domains of knowledge. Today I'm going to start the first 2 weeks on, maybe I'm doing acupuncture. I'm going to start with lung and large intestine channel, right, for the first couple of weeks. And then I'm going to move on to, stomach and spleen channel for the next maybe 3 weeks because they're longer or whatever it is. Okay? So you split it out into sections and then split those sections out into sections that you can cover in about 2 to 3 hours of study. Okay? And then you got to make a schedule, right? So you want to make a schedule where you're studying every day, right, for that 3 to 6 month period that you're preparing for the exam. And then you want to, about a week before the exam, you don't want to be adding anything new. You want to just be reviewing stuff you've already read over. Okay? So you got to have so you want to be, that's how you want to kind of break it down. Right? And then tips they have, try and study about the same time every day. Like find a time of day where you're really fresh and it feels good to study, and try and do that at the same time every day. Okay? The other thing is, exercise before you study. Sometimes that makes it easier to sit. It also makes it easier to retain knowledge a little bit. Typically also, you want to conclude your studying an hour or two before bedtime. You don't want to study up too close to bedtime because it'll make it hard to sleep. And then sleeping is important because that's how you start to commit short-term memory stuff to long-term memory. This typically after sleep. Okay. One of the recommendations that Valerie Hobbs, who was our old director of program development, used to have was, first thing you do when you're getting ready to prepare, reread The Web That Has No Weaver. You guys remember that? Back from the beginning of school, Ted Captcha, right? And it doesn't have to be that book, but something similar to that, okay? Something that's a good synopsis of the basic, lowdown on Chinese medicine, okay? Because it'll mean different stuff to you now, okay? It'll be a different experience to read that book after you completed a program than when you started, okay? And it'll help get you back in that mode, right? Of Zong Fu differentiation and, kind of the basics of foundations and Chinese medicine in general, okay? And so then at the beginning, and then break it up, make a schedule, start studying every day, and then get into a habit. Every time when I sit down, especially for points, for example, first thing you do is if I'm going over the lung, large intestine, stomach, and spleen channels, sit down and do your phone numbers. You guys know your phone numbers, right? What are all the shoe points of the lung channel, right? What are all the shoe points of the large intestine channel? You should be able to do it from memory, right? You should know what's their title, Jing Well, Jing River, Shoe Stream, Club Uniting Point, right? Then you should also know their 5 elements, right? Which one is the metal point, which one is the wood point, which is the fire point, etc. Okay? In addition to the location, in addition to the basic indication. Okay? The other thing they might ask you about is actually needling depth and angle. Okay? So there's an example of a good studying schedule, right? So I start my first 2 weeks of studying in April, right? Read The Web That Has No Weaver, then review yin-yang theory, then review 5 elements theory. You could add more time to this depending on whether or not the subject is something you feel really confident in or whether it's something that you're challenged by more. This is your study. This is your process. Okay? So you really want to make sure that you're doing what fits for you, right? And studying the information that you have, that's beneficial to you, right? And so break it up into a good schedule where you're studying a little bit every day and reviewing what you've studied. And then, give a day of rest or something like that in there in order to make yourself feel a little bit more not overwhelmed. Oh, sources for foundations in acupuncture, they're not going to ask any Chinese history. You don't have to know what dynasty, Sun Sima wrote the 1,000 different formulas in or anything like that. So you don't have to worry so much about that. But yin-yang, 5 element stuff, CAM, foundations. One of my teachers in school used to say, before you take the national exams, you should have a red CAM cover to cover twice. Was his recommendation. Okay. Zong Fu information, foundations is probably the strongest one. Qi blood and body fluid differentiation, CAM and foundations. Channels, meridians, primarily Deadman. Okay. The thing about Deadman, I would say, if you're looking at things like extra points, you might look at the Densky O'Connor and the Shanghai text, just because they have the most comprehensive list of extra points. The content outline for the acupuncture exam gives you a list of extra points that you're supposed to know. Okay? So point insertions, mostly the depth of insertion and angles are going to be from Deadman. If you go to rootdown.us, has anybody been to that? Like a wiki site that a bunch of students of Chinese medicine put up over the last few years. So you can actually join up and start editing. But so what they've done there, what's really nice about that site, is that on all the point information they have both CAM and Deadman, so you can see it side by side. Here's how Deadman describes it. Here's how CAM describes it. Here's the left and needle angling from CAM. Here's what it is from Deadman. So it's nice you can compare easily. And they have indications of functions and stuff like that too. But that's one of the things I found was really useful on that side. They also do a bunch of herb stuff, mostly from Densky, and that also includes some of their modifications and stuff like that. Remember, for herb exam, God, no modification is one of the things they include on the Chinese numerology. Okay. Point energetics, mostly Deadman again. Channels, Deadman, instruments in Shanghai. Extraordinary vessels, mostly Deadman stuff. And then remember, you also got to note they might ask you questions about intersection and crossing points. Like which point is the point at which the stomach yongning also crosses with the spleen, or also crosses with Shaoyang, like the gallbladder. Okay? So when they talk about those crossing points and deadness of it, you're actually supposed to know all that stuff. Okay? Or at least it's potential subject matter for the exam. Okay? Foundations, etiology and pathogenesis, mostly going to be foundations in CAM. Okay? Tongue stuff, mostly Maciocia, probably, right, for most of these. Pulse, she indicated Webb that has in Weaver, probably a good source for that. I'd say CAM's probably not a bad source for basic pulse images too. Differentiation of syndrome, CAM is a solid source for that pretty well, especially if you're talking about Zhang-Fu syndrome, things like that. Valerie's recommendation was chapter 13 in CAM, you should know the whole thing. Like all of those syndromes, how to differentiate them. Acupuncture techniques, CAM chapter 14 and 15 talk about acupuncture technique, like how do you tonify, how do you disperse, right, etc. Sources and foundations for acupuncture cases. Remember that a lot of questions on foundations are going to be, and on the acupuncture exam too, are going to be in the form of case studies. Like they'll give you a case presentation, then they'll ask you to make a diagnosis or ask you which of the following point prescriptions is most important, is most appropriate, or which of the following diagnoses is the most appropriate. Okay, and so remember when you read any exam, and this is true for your courses right now too, partially because we try and formulate them, to help you guys prepare for the national certification exams, and partially it's just a feature of the way traditional Chinese medicine is kind of structured. When you're looking at doing a case study, there should be 3 things that you focus on. I already hassled my class from this morning with this. Okay? You guys know what are your 3 things you should look at on a case study?
Main complaint.
Main complaint. Always main complaint. This person came in for cough. This person came in for abdominal pain. Okay? This person came in for diarrhea, whatever it is. Okay? Because they'll state it in there. They'll give you, here's the person's main complaint. Okay? The next 2 things, what do you think?
Tongue and pulse.
Yeah, tongue and pulse. Okay? And so remember, this is going to be at the top, probably, right? Main complaint. Patient seeks treatment for coughing. Right? Patient seeks treatment for leg pain. Like that. Then the tongue and pulse are probably going to be at the bottom. Right? They're going to go, signs and symptoms, all the other detail that they give you in a case study. And the person's pulse felt like this, and the person's tongue looked like this. Okay? So first read main complaint, then read tongue and pulse. And the reason being is because in TCM, these are confirmation of diagnosis. Right? So they're never going to give you a cold diagnosis with a red tongue. Right? They're not going to give you a heat diagnosis with a pale, flabby tongue, right? They're not going to give you a yin deficient diagnosis with a flooding pulse, probably, right? If your diagnosis that you think is probably right, according to the choices they give you, doesn't match this tongue and pulse, you're probably not right. Okay? And that's true with your exams again right now. Read case study, read main complaint, tongue and pulse. Tongue and pulse should be congruous, and then the signs and symptoms should match up with what you get from the tongue and pulse. Okay? If they don't, rethink what your diagnosis is. Okay? And as long as you kind of fit, so that's just like an exam strategy, right, to think about when you're looking at case studies. And that's really helpful when you get overwhelmed by a bunch of case studies. And both case studies and patients will sometimes throw a lot of data at you, right? A lot of information, they're kind of meandering all over the place. Which signs and symptoms are relevant, which aren't, what's going on, right? This helps you sort through that, okay? Right, and then, practice of Chinese, if they ask you gynecological questions, you're talking about menstrual disorders, something like that, probably you're gonna look at Maciocia is gonna be the best source for that. And then CAM chapter 16 through 18. Foundations in acupuncture, ear acupuncture, Abate, Dr. Abate's book is a strong resource for this. Olison's book is a strong resource for this. CAM actually has information about ear acupuncture as well. It's a pretty strong resource. I actually also like the Bensky, Connor book, the Shanghai, what they sometimes call the Shanghai text. Remember that when you're talking about auricular acupuncture, that can show up on the acupuncture exam. So review your ear anatomy, right? What's the helix, what's the tragus, what's the antitragus, auricle, all that stuff, because that'll help you recognize the descriptions of points. Okay? And generally understand kind of like the homunculus that's in the ear. That's another good tip, right? It's like the upside down V, right? And that way you know, oh, if it's up here, it's probably lower back or something like that, right? If it's down here, it's probably neck, shoulder stuff, right? And that'll keep you from making errors. Right? SWAT courses are pretty strong at preparing people for auricular acupuncture. We go over it in a lot of detail. And then, some courses will even add additional auricular prescription and discussion in other courses. So pretty solid on your acupuncture, but just don't forget that they do include that on the acupuncture exam. Okay? If they're going to ask you about any microsystem, it's probably going to be the ear microsystem. Okay? And when to use practice tests. So practice tests can be, usually for a fee, can be found at places like tcmtest.com. NCCAOM also publishes practice tests that you can subscribe to. So those can be a good tool, but just keep in mind those are not your only study tool. And in fact, practice tests are not a study tool. Okay, they're just to evaluate your study. Okay, so what you want to do is after you've studied all the subjects that you've got to cover for your exam about once, which takes you about 1 to 1.5 months of your 3-month, preparation time. Okay, if it's something really challenging, maybe 6 months, or so maybe in the end of your first 2 months or 3 months. Okay. But about halfway through, then you can go and take some practice tests, okay? And then what you want to see is look at your practice tests. How did you perform in the practice test, right? Which parts were strong, which parts were weak, right? And then go back and review again. Find those things that you were strong on. Okay, that's stuff that I can kind of review lightly. Things that I was weaker on, that's the stuff you got to really review more heavily, okay? So then you go back and do that, review the stuff that you didn't do so well on, take another practice exam, see how you do, go back, if there's anything that you were weak on, study it again, take another practice test. Keep doing that, and restudying every topic that you're missing questions on until you can pass those exams with at least those practice tests with 80% or better every time. Okay? And when you can do that, you're ready to take an exam. Okay? Other sources that are kind of solid, Handbook of Oriental Medicine by H.B. Kim. This was actually written for the CALE, the California licensing exam. But it's a really nice book with a lot of charts and kind of like and graphs and things like that really just kind of lay out synopses of things like all the herbal incompatibilities, right? All the master couple points for the 8X, or all the shoestring points for the different channels. So like they'll give you these charts that'll break things down. Okay? So it can be a nice graphic representation. It's a good resource. TCM Review and TCM Tests will offer practice tests. Some of these they used to have like free tests, like like they weren't free, but once a month between this day and this day, they'd let you take exams for free a little bit because they're trying to try out their service, so you can subscribe. Sometimes people will subscribe, they'll share subscriptions a little bit like that. I can't endorse or support things like sharing subscriptions for any reason, but I've heard that's something that people have sometimes done. Okay, but it just means you can't use them together, which is a problem. If you look at something you're studying in CAM and there's a chart about it, you probably ought to know everything in the chart. Okay, so that's something to kind of keep in mind. So it's like examples for symptomatic point selections. They like to do that. If this person is presenting with a fever, what's a common TCM prescription for treating fever, right? And what you want to be able to do is identify it, right? If this is a heat condition, and 2 of the choices have Li11 and 2 don't, well, you've eliminated 2 choices, right? Because you know that that's a likely heat prescription. And then you just have to decide between which of those 2 is the most likely. Right? But you really want to think about your points in that way, and remember these like point groupings that they do for TCMs. Like they like to put those kinds of things in the exam. Okay? Studying for biomedicine, they actually give you a list of conditions they want you to be familiar with as part of the exam content outline for biomed. It's a list that I think the WHO had put together that were like conditions effectively, like evidence for effective treatment with acupuncture. Like in fact, that's how we break down like your Western physical exam and pathology courses, right? And or was it Western diagnosis and pathology? Those courses, the reason we choose the particular conditions in those courses to cover that we do is because they show up on the national certification exams, are listed as part of the biomed exam. Okay, that's how we choose a lot of those choose that topic, right? And so you want to make careful study guides from that outline, okay? The other thing to remember about biomedicine, is they also have to they ask you stuff about practice management, ethics, Hipaa, OSHA, CNT, all that stuff is fair game for biomedicine. Okay? Some of that CNT stuff might even show up in the acupuncture as well. Okay? And so sources for that, for ethics, NCCAOM has like an ethics statement that they put on their website. You should be familiar with that. That's where they're going to draw a lot of ethics questions, partially because some of the rules might vary state to state. So it's a way for them to maintain consistency, right, in the exam. Other things like, Hipaa, OSHA things. Remember our Hipaa manual, right, that we have posted as part of our clinical documents, our OSHA manual that are posted as part of the clinical documents, bloodborne pathogen exposure control, all part of our standard documents. What I would like to remind people about the Hipaa documents, for example, in particular, that manual is about 38 pages or so, right? But when you guys are practicing in clinic, you're probably only really on the hook for about the first 10 pages or so of that manual, right? Because it's like, as a practitioner, how do I protect patient confidentiality? How do I keep my voice down? How do I de-identify information when I'm discussing cases, et cetera, right? But the remainder of that manual is going to include things like, how do I manage HIPAA-related material in an office-to-office setting, right? If somebody wants records, how can they request records? What do I need to release medical records? Like all of that kind of information. That's also contained in our HIPAA manual, but that you guys really haven't had to manage so much yet, right? Because that's managed by the clinic staff, okay? So be aware that you want to review some of that stuff, and that can also show up on the exam, okay? CNT stuff, you got to review. Make sure that you're reviewing the most recent manual. I don't think it's changed since most of you guys took CNT, or probably by the time you guys take your exams. But be aware that they do publish occasionally revised versions of the CNT manual, and it's potentially that you could be on the hook for the most recent, right? But do review your CNT manuals before you go in, okay? Especially for biomed. Okay. And so they say NCCAOM Exam Code, that's what we're talking about, Code of Ethics. Okay. And then you can review pretests for the California exams as a good resource. That was one of Valerie's recommendations. Or those TCM tests and stuff as well. Heavy stuff. I mean, it's a heavy thing to study for a national certification. It's a high stakes exam, it's expensive, you've got to go to a special place, they're going to make you follow special rules. It's going to feel heavy. And the amount of information, it feels heavy, right? And so just the main thing that you want to do is really be prepared for that. Be prepared for it to be heavy. Do your work ahead of time, and then you'll feel confident when you get there, okay? But don't think you're going to wing it. Yeah, I did pretty good in nerd class, man. I'm going to just go ahead and take my exam a month after I'm done with school. Don't do it, okay? Spend the time, right? Because this isn't cheap either. We'll talk about fees and stuff like that too. Right? So we want to be caught, we want to make sure that you guys have the best chance of success the first time around, because it reflects on me, right? I need to see those first-time test takers being successful, right? Otherwise it's like, Dr. Rossignol, what kind of school are you running over there, right? I mean, I say that a little bit flippant, but, I want everybody to be successful. I want you guys to not have barriers to licensure. Studying Chinese herbal stuff, remember our Herbology class is excellent, but it's not enough by itself, right? It makes good resources for you to prepare your studying for herbology exam, okay? So you need a couple of months to put information together. Don't forget some of them include the Western actions. They do sometimes ask, is this anti-inflammatory? Is this cholesterol reducing? Some of those other Western clinical indications. And look at if there's any clear drug-herb interactions, right? That might be something they can include. There's the content outline for the herbology exam gives you a list of all the formulas that could appear on the exam. Some of which they may ask you about directly, some of which are like, they're just to be answers, like distractor answers, right? And so you should know all of them, okay? You got to know not just the indications of the formulae, but you should know the constituents and you should know modification as well, okay? Because they may ask. Also, good dispensary practices. Some of that's contained in our clinic manual as well, information about, how to operate a dispensary and maintain cleanliness, things like that. They may ask that as well. They may also ask about vitamins and supplements as part of the the herbal exam, especially like when it's like macronutrients and vitamins and stuff like that. Okay. Once you sign up for exams, you'll schedule exams at a testing center. When you show up at the testing center for the exam, you can't have anything with you in the exam. No phone, no purse, no nothing. They make you sit down, you've got to have a pen, and they provide you with like a scratch paper board or something similar. Okay? But you know, they'll often, you know, if you have a phone with you, they may have you lock it up on site. You know, you can't have anything with you. Okay? You'll be fingerprinted as part of your exam application, and you'll be videoed during the entirety of the exam. Okay? Yeah, they don't mess around. Okay, it's very serious. It's a high stakes exam. Okay, and then they'll give you again a whiteboard or a scratch paper to kind of dump your brain onto. And so one of the things that you know, you also will sign some agreements, right? You'll sign an agreement, no cheating, and all those. You know, and they'll explain to you the policy against cheating and what'll happen if you do, and all that kind of stuff. What constitutes cheating? They'll probably include that in the part of their lecture. Okay, so they'll have you sign all that first. Okay, and then you know, and then it's timed, and then you have to sign in on time in front of your thing. So you got to make sure you sign into your exam before the time for your to fill out the ethics statement is completed. Otherwise, they'll lock you out. Okay? And they'll tell you how much time you have. There's probably going to be a timer and they'll warn you, oh, 1 minute. But just keep in mind, okay? And so make sure that you sign into the exam on time and then dump your brain on the whiteboard. Okay? Don't try and start doing that waiting for the exam time to start, because otherwise you might not sign in on time and get locked out. Okay? And that's just like a thing that sometimes when people are anxious, it's an error they'll make. Yes?
When you say dump your brain, would an example of that be like writing down all the telephone numbers?
Yeah, that's a good thing, right? That's like, all my urban compatibilities. What are they? Right? All, you know, those kinds of things are good to get down, right? Or maybe even just make a star, do your 5 elements so that you know controlling, and you know productive, and you know production. Like those kinds of things can be really beneficial, just because it'll help reduce anxiety a little bit, and it'll get your brain going, and then also like you have it to refer to. Remember, once you've answered a question, it's gone. Now you can't go back and re-answer it. Okay? So you know, look at the question, read it, answer each question the best you can. Don't think, well, I'm not sure, but I'll go back and check. No, you got to answer the best you can the first time. Okay. And then once you've completed the exam, you should get a pass-fail notice immediately after the exam. It's like, boom, you have passed NCCAOM preliminary exam result. Okay. And then you'll get like an official result that'll come probably via email. I don't think they use snail mail so much for this anymore, but it'll probably come in your email. Okay. And I think that's enough for the testing portion of it. Yeah, just be aware that they're very serious about it. Okay. Yeah.
When we are getting licensed by the state, do we have to give them the test, or does NCCAOM email the state?
I think you request that the exam results be sent from NCCAOM to the state.
Before taking the test?
Yes.
Okay.
No, not before taking the NCCAOM exam.
Got it.
Although for the state of New Mexico, they've changed the rules in the state of New Mexico that you must have completed all 4 modules in your NCCAOM before you can sit for the state exam. Like it used to be, the old rule was that you could, you know, sign up and sit for the state exam, and you had up to a year to complete your application for the state exam, which meant that you could, you know, maybe take 2 tests and then take your state exam, and then after that's done, you could take the next 2 NCCAOM exams. Not anymore. In order to sit for the state exam, you have to have all 4 modules successfully completed to take it. Okay? That's another one I was saying that burns people coming in from out of state, right? Well, I didn't have to have a neurology module in Colorado or, you know, or Wyoming or wherever I was. And then they come into New Mexico, and then New Mexico's like, hey man, you can't even sit for our licensure exam until we have that grade for your NCCAOM herbology module. And then they're stuck, right? They gotta go back and refresh their herbal knowledge in order to get that, just to sit for the state exam. And then you gotta wait around for the state exam to come on. You know? So it's good to make a good plan and be ready for those time barriers a little bit, so that you know what to expect. Any questions about testing generally? Yeah.
How long should we submit a application to the state board before we can do it? Like if they are going to do, let's say, May 10th, shall we do like 60 days before? Is that?
I would say at least, you know, I mean, the thing is you gotta have all your NCCAOM exam stuff completed already.
Yeah.
So however, so once you've got that, then yeah, like I would try, I think they'll give you deadlines on the state exam website for when those documents have to be in. Okay. Assuming RLD gets our website together like they're supposed to. That's been a little bit of a challenge, honestly, with RLD, but not having updated information on the website so we know when the exams and the deadlines are and stuff. But they're working on it. The board has been leaning on them to really try and make sure they're updating things more regularly. Okay, but that'll be all on the website for the next state exam. So remember, cheating, asking the content of questions or talking about the content of questions afterwards, if they find out you did that, they consider that cheating. Okay? So you know, you'll see people say, oh, let's see if I can remember a bunch of questions and I'll give them to my friend who's going to take this. And don't do that. They consider that cheating. Okay? So they find out that you were doing that. Then it can be detrimental for you. Okay? And don't worry about it anyway. Nobody gets the same 2 exams anyway, right? It's an adaptive exam. So the exam you get is different than the one you get, different from the one you get. So you might write down 10, 15, 25 questions, and then the next person gets 2 different questions anyway. Okay? So cheating doesn't benefit anybody, essentially. It's set up that way. So how do you start? As of November 1st, 2018, NCCAOM no longer accepts pre-graduation applications. So you have to have your diploma in hand in order to begin sitting for your NCCAOM exams. Okay? They made some caveat for some people that came in at the end of that who are getting ready to complete programs who I think had, if you're graduating 2021, they might have, by a certain date, they permitted you to go ahead and sit under the old rules. But going forward, you must have diploma in hand before you can even apply to NCCAOM. Okay? You know, application to the exams is completed online through the NCCAOM website. Part of that application is going to include submission of your C&T certification. That's required to sit for NCCAOM. It's also a graduation requirement for us. And so that CCAOM, you have to contact CCAOM and have them send that result directly to NCCAOM as part of your application. Okay? Definitely review the new C&T manual. And again, we mentioned recent data shows that students do better on exams if you take them either while, you know, as soon as you can while you're enrolled in school. Back when this was initially written, even just a couple of years ago, you used to be able to sit before you finished school. But even if you can't sit while you're in school, as close as you can schedule them to your date of graduation, data indicates people are more successful on the exam. Okay? And the scores tend to kind of go down the further out from graduation that you take the exams. Okay? Also keep in mind, like if you delay sitting for exams after you graduate, especially if you found that you were struggling a little bit in school, it's worth the investment to get an exam prep course, okay? Which you can find out about online. Also, alumni are permitted to audit courses at SWAC. So if you know you've been a while since you've been in school, you're getting ready to take an exam, and you're like, boy, I really need to review my Zongfu theory, then you can come sit for, you know, Eric's Zongfu class or something like that, as, you know, an audit as an alumni. And I think they just make you pay like a minimal registration fee and stuff like that. The only thing you got to remember about auditing is that because you can only offer stuff like once a year, right? Like if there's something you want to take, you need to figure out when it's going to be, and or if it comes up as an opportunity, you can't wait because it might not come up again for a year. Okay? The other thing I would recommend strongly is get study groups together and make connections with your classmates. Again, the people I've seen be the most successful on these exams, and what I've observed as an instructor is that those are the people that perform the best. Okay, going back to I've been teaching students here since about 2008, and that's the cohorts that I've seen be the most successful had those strong connections, or asking each other, or doing study groups. And it also just makes it way more fun because you know it's heavy. This preparation is heavy. It's frustrating. You know, having other people to commiserate with and help each other out is really beneficial. Step-by-step process. If you're ready to go, you know, sign up for your exams, go to the NCCAOM website, and then it'll give you a section for certification requirements. And you scroll down to the bottom, and so there's the process, right? So, you know, you have to satisfy the educational requirements. That means you have to have your diploma. Okay. Submit an online application. Submit that final graduation transcript. Submit your clean needle technique. And then you'll get a little letter in your email that it's what they call an authorization test. It's like, we have received all of your completed applications. You are ready to take exams now. Okay, so that's kind of like what permits you to then sit for the exam modules. Okay, so then once you have that letter, that means your application is completed, and now you can start signing up for exam modules. Okay, one of the nice things about these computerized exams, adaptive exams, is they can offer them kind of like whenever during the year. It's not like it just like when I went back and took it, it was on paper or that kind of stuff where you had to like, you can only get it between this period and this period, and then the next time around is this period and this period. You know, so you really were stuck only doing it a few times a year. Now you can schedule it at exam centers pretty much whenever, okay? Which makes it nice. It's ready for you to take it when you feel like you're ready to take it. Okay, you don't have to wait another 3 months or whatever. Okay, and then you got to complete all your board exams successfully, and then they'll issue you a diploma, you know, depending diploma in acupuncture or diploma in Oriental medicine. Application fees. So again, you want to take it seriously because it's not cheap. Okay. You know, the Oriental medicine certification application, the application is about $600, right? $595. That's not including the exam modules, that's just completing the application. Okay? And so, you know, the actual examination fees per module, okay, are about $310 a piece. Okay? If you let it lapse, you have to go back and do the Chinese herbology again, then it's really, I mean, sticky for like $500. Okay, so keep that. One of my recommendations is once you have a diploma, acupuncture or Oriental medicine, maintain the diploma. Okay, it's not that expensive. It costs $225 right now every 4 years, plus whatever the cost of your CEUs are. Okay, and you know, in New Mexico, for example, we have to maintain 15 CEUs every year in order for us to maintain our license every year. The NCCAOM diplomate takes 60 every 4 years, right? So for me, I have to do the same amount of CEUs either way, right? I have to maintain my state license in order to keep my NCCAOM. In New Mexico and in most states, you need your NCCAOM to sit for initial licensure, but once you're licensed in that state, you don't have to maintain it to get your license to renew your license every year, okay? For most states, okay? But I recommend that you do, because I see a lot of people talking on the internet and acupuncturists on Facebook and different social media stuff where they're like, oh, NCCAOM, it's so expensive, they're just trying to stick you for money. And it's like, honestly, between 60 CEU credits every 4 years and a $225 fee, if I break that up over 4 years, it's still probably one of the cheapest professional expenses that I have, you know? And you want to maintain it because if you let it lapse, well, maybe you're practicing in Colorado and I didn't have to worry about it. And then, again, suddenly I want to come back and practice in New Mexico. They're like, oh, to sit for initial licensure, you need a current diploma in from NCCAOM. Not just that you can prove you did it in the past, but it's got to be current. So if you let it lapse, now you're going to be on the hook for all kinds of fees to go get it reinstated, etc. Which might mean you have to study for exams again. Yuck, right? Nobody wants that, right? So my recommendation is once you have that diploma, renew it every 4 years, maintain your diploma. It'll make you more flexible so you can move around the country if you need to. The other thing about it is that certain institutions, certain insurance providers may require that you have it in order to either work for them or in order to build their insurance. I don't know, it's like, you know, not everybody, but certain institutions will include that as a requirement. So it's one of those things like, make your life easy, just maintain the diploma, you know? We can have another discussion with people like, I think NCCAOM actually does a lot of benefit for the profession overall. Some people disagree with that. I tend to think that they actually benefit the profession quite a bit. So it doesn't hurt my feelings necessarily to, you know, put some money into that. The tough part is most other professions that require that kind of renewal, most of the professions require you to renew your license, right? Nursing and massage therapy and all kinds of professions that require it. The thing that's just kind of a drag for acupuncturists is that nobody else is paying it for you, right? Like, yeah, if you're some of these Western medical professions, sometimes the institution you work for will help you with your license or help you with CEUs and things like that. Most of the time as an acupuncturist, you're kind of on the hook by yourself, okay? So that's a little bit frustrating, but that's more of like a systemic frustration, you know, than it is like a problem with NCCAOM. You know, it's like, why don't people You know, why aren't we employed more institutions? Why aren't we getting that same support? But it's not necessarily a blame on NCCAOM. And then, you know, put the time in. Own your transformation. This is you becoming a professional, right? Your studying is up to you. How you study, the way that you put it together. It's important that you create your own study materials because that's what's going to make sense to you, right? Don't just say, oh, my friend just prepared for it. Let me get all his study charts. It's like, yeah, that can be a helpful guide, but you've got to put the material together in a way that makes sense to you, okay? Because if you don't, you're not going to remember it as well, okay? You got to own the transformation and you got to own the, you know, your understanding of the material, your organization of the material. It'll make it better. It'll make you a better practitioner, and it'll make it easier to remember the voluminous amount of stuff that you got to remember for this exam. Okay. And that's all I've got as far as a presentation for you guys today. Is there any other questions or comments or concerns? I'll do my best to answer. Sure.
So there are about 100 questions per exam?
More or less.
Okay.
Yeah, I think some might be a little bit longer, like 120 or 150. And actually, they just reformulated this exam in 2020. Really, like they put together a new exam that they rolled out on what they call a linear exam schedule in 2020 because they had to test the exam content, right? So it's easier to get that data back on a linear exam. And they were supposed to do that for the entirety of 2020. But you know what happened in 2020, right? Everything got all messed up because of this COVID business. It limited exams, it limited opportunities for people. And so what they found is that they had gotten back enough data by the end of the first part of the year that they felt confident in the exam. So they actually rolled out the exam back to an adaptive exam in May of 2020. So the exam went back to being available as an adaptive exam. But content centers were still restricted heavily. Right? So it's only been in the last 6 months or so where they've really had the testing centers have become more available for everybody. You know, with the relaxing of the requirements for COVID and everything. And so consequently, some of the folks I've talked to who are studying up for exams have also found there's a backlog, right? Like, you know, you can cite your first available test might be further away because there's a backlog of people getting caught up from last year. Okay, so that's something you might want to look into. So if you're getting ready to sign up, you know, do it as soon as you can, just so that you don't get stuck waiting around for an exam. Hopefully, after they can clear some of that backlog, it'll be back to being more regular, more accessible for everyone. Yes?
I have a question. So for the modules, specifically for the acupuncture, which is point location, energetics, and then the herbs too, is there any visual ID that we have to do? Like for point location, will they give us like a little
yes,
thumbnail?
Sometimes.
And then with herbs, will they give us a thumbnail of what the herb is?
I would have to review the new content outline for the herbology exam.
Okay.
I don't remember people talking about visual ID. I mean, it's part of one of the competencies we have to teach for accreditation, but I don't think that the herbology exam does a lot of sight ID.
Okay.
Acupuncture, definitely.
Okay.
They'll give you pictures you gotta be able to identify. And actually, I'd have to review that for the herbology exam with this new exam too. I'd have to look at the new content outline. As they could, and with an adaptive exam, you've got a computer terminal, they can be like, here it is, we'll use it.
Right.
You know, historically that hasn't been a heavy part of the exam.
Okay. Thank you.
All right, well, if there's no other questions or anything, I really appreciate everybody showing up. If you guys have any additional questions that come to you about signing up for exams or help with preparation or anything, please reach out to Susan or I. We'll do our very best to give you guys more resources, point you in the right direction.